Kristen, I have a question for you, certainly in your patient journey. Um, there often there's a myth that chronic urticaria lasts forever, for a lifetime. So could you maybe share a bit about your experience and just reflect on that myth?
Sure, absolutely. One of the things I'm just going to say before I turn to that, because it really struck me when you both said this, was this is not a psychiatric illness. I will say oftentimes as patients with this condition, hives in general, we are often told that if we just calm down, if we just, if we aren't so anxious, this will not happen to us, right? If we just stop all the stress in our lives. And it does come across, this is very mainstream conversation that people have, not just healthcare professionals, right? It's the general public that has sort of adopted this. So hearing this from you is so freeing and so validating to me because this is not what happened to me or to many of the, other people. And it's just very nice to hear that. Um, my urticaria started when I was in my 20s. I'm 51 right now. And every decade I had an acute or more than one acute bout of hives, where originally triggers for me were things like detergents, or I have a tendency to use lotions that smell fantastic but are terrible for me personally. And then I got into my 40s and they became chronic. And this was unlike anything I had ever experienced before. This really took over my entire life. I could not work well. I could not drive my car. I couldn't take care of my pets. Frankly, I couldn't bathe easily or get clothed because it just was so excruciating to have anything touching my skin. It was terrible. Now, in my case, I was, I didn't, I went to the level that Dr. Bernstein was talking about before of antihistamines and other medications, and that did not control it. And ultimately, it was through a biologic that mine were brought under control after 6 months. Now, in my case, I can say that I'm lucky that right now I do not have them, so that I can say I'm sort of living proof and hope that these do not always last for life. I am always cautious, and you can tell me what you think of this. I'm always cautious because I never know that they're fully gone. Given my experience in the past, when will these old friends of mine, so I use that term quite loosely, when will these old friends of mine make themselves known again, right? I do live like that, but I certainly do not live with it every day. And I feel very lucky, and I hope that that provides some hope. So, what are your thoughts on that, the two of you?
Well, first of all, hives, typically the general thought is they last anywhere from 1 to 5 years, and they can go into remission spontaneously. This is one reason why when we treat patients and we get them completely controlled, and we use different patient-reported outcome measures to assess that using something called the urticaria control test, which is a standardized, simple questionnaire that tells patients can tell their clinician, their physician or nurse practitioner that they're well controlled. Or there's in clinical studies more than anything, we use something called the urticaria activity score, but it's the same concept. So we use this, and when patients are completely controlled, there's no hives, there's no itch, there's no impairment. And this is on medication. So we treat them. How long do we treat them? Well, there's a variable response. Maybe some people say 3 to 6 months, up to 6 months, where there's no hives. And then do we step down? Because like everything else, there's a beginning and there's an end. And so we do try to step down after, let's say, 6 months to see if hives reappear. And in some patients, they do. In others, patients can come off. Now, in those situations, there may be a situation where the hives come back. And it may be over several months or several weeks or months, depending on the treatment that they were taking. But sometimes it doesn't come back. So it is variable. Right now, we don't have any good markers for knowing who we can drive into remission or cure the hives. But it is variable. In your case, I think when you have an inducible component, like dermatographism, which is what you're referring to, those are more persistent and they can last much longer and they don't go away as quickly. And I think one of the important points you mentioned is you didn't like putting stuff on your skin, but once you control dermatographia with medication, moisturizing is extremely important because if you itch, you scratch. And if you scratch, you welt. And if you welt, you itch. And if you itch, you welt. You scratch. And so it's an itch scratch cycle. When it's crazy, it just keeps going and going and going. So you got to moisturize as well. And we recommend products that have very few ingredients that are very easy on the skin, nothing elaborate, like you mentioned, perfumes and things of that nature. But that being said, it is an important component because we found in some studies that barrier proteins are affected in hives. And so disruption, maybe it's due to the scratching, the trauma, but it could also be a lot of the skin diseases we take care of actually have barrier protein dysfunction. Or disruption. So I think that it's an interesting disease. We're learning more and more. And I think, but it doesn't always behave the same. Some people it's more persistent, other people it can go into remission.
Kristen, I think another point that you brought up that is deserves probably a little emphasis, bold font, is that you're not living in fear, right? So you're living your life, but with a healthy respect, what we would call anticipatory guidance, right? You're looking, at the future, like, okay, if it happens, if the symptoms do return, I've got a plan, I've got to go to, etc. So, the priority is medical management, and then certainly take care of your well-being. And then when you do have the resolution, not living in fear, but being mindful.
That's just a perfect way to say it. A healthy respect. That is exactly what I feel. And I would have been more dismissive in my younger decades. I will say that, oh, it was just this, or I used a different detergent. And now when these come to my doorstep, immediately, I know I have a kit of sort of a survival kit with me so I can start antihistamines if I need to right away. I know exactly what to use. And so that's exactly how I treat it.